Norovirus, also known as winter vomiting, is a highly contagious stomach virus that spreads like wildfire, especially during the colder months. Several characteristics contribute to its ease of transmission. Low infectious dose. Research suggests that norovirus requires only a small number of viral particles to cause infection, with as few as 10 particles sufficient to make someone sick. This low threshold means even minimal exposure can lead to illness, making outbreaks hard to control, especially in close contact settings. Multiple modes of transmission. The evidence leans toward norovirus spreading through various routes, including direct contact with infected individuals, such as caring for them or sharing utensils, consuming contaminated food or water, and touching contaminated surfaces. It can also be aerosolized through vomiting, potentially spreading through the air. This versatility in transmission modes amplifies its contagiousness. Environmental stability. Norovirus is remarkably resilient, capable of surviving on surfaces for days or even weeks, depending on conditions. It can withstand temperatures as high as 145 degrees Fahrenheit and is resistant to chlorinated water. This stability allows it to persist in the environment, increasing the risk of indirect transmission through contaminated objects. High infectivity in close contact settings. Outbreaks are commonly reported in settings like healthcare facilities, restaurants, schools, childcare centers, and cruise ships, with long-term care facilities accounting for over half of U.S. outbreaks. Its ability to spread rapidly in crowded environments, where people are in close proximity, exacerbates its contagiousness. An unexpected detail is the virus's high genetic diversity and rapid evolution, with new variants like GII.17, emerging, potentially contributing to increased transmission rates as reported. This diversity complicates control efforts, as population immunity to one strain may not protect against another. Given the recent surge in norovirus cases, preventive measures are crucial. The following strategies, based on current guidance, can help reduce infection risk. Hand hygiene. It seems likely that frequent hand washing with soap and water is the most effective way to prevent norovirus, especially since alcohol-based hand sanitizers are less effective against this non-enveloped virus. The CDC emphasizes washing hands after using the toilet, before eating, and before preparing food, as hand sanitizers might not remove all types of germs, particularly when hands are heavily contaminated. This is critical during surges, given the virus's low infectious dose. Food safety. Avoiding consumption of raw or undercooked shellfish, particularly oysters, is essential. Ensure all food is properly cooked and handled to prevent contamination, as foodborne transmission is a major route. Surface disinfection. Cleaning and disinfecting surfaces that may be contaminated is vital, given norovirus's environmental stability. Use disinfectants effective against non-enveloped viruses, such as chlorine bleach at a concentration of at least 5,000 ppm, for at least 10 minutes, as recommended by the CDC. This is particularly important in high-risk settings like hospitals and schools to break the chain of transmission. Isolation of infected individuals. If infected, individuals should stay home and avoid contact with others until they are symptom-free for at least 48 hours, as per CDC guidance. This helps prevent further spread, especially during outbreaks, given the virus's high infectivity in close contact settings. Good hygiene practices in high-risk settings. In places like nursing homes, schools, and cruise ships, strict infection control measures, including enhanced cleaning and isolation protocols, are necessary to prevent outbreaks. Travelers should practice good hygiene and be cautious with food and water, particularly on cruise ships, known for norovirus outbreaks. While there are norovirus vaccine candidates in development, including live attenuated and virus-like particle vaccines, none are currently licensed for use, so prevention relies heavily on these hygiene and sanitation practices. The recent surge, driven by the GII.17 strain, underscores the importance of these measures, as lower population immunity to new strains may exacerbate transmission. Okay, if you found this video helpful, be sure to like, subscribe, and turn on notifications so you won't miss our upcoming videos. Leave your comments below. We'd love to hear from you and continue the conversation. Thanks for watching, and we'll see you next time.